Okay, so you all know how to place the bolster under the knees when she is supine. Not under the ankles, under the knees. So we come under the knees, under the sheet, and then we lift the client's knees for them. And just slide the bolster under. Are you comfortable? And then I always just touch right here just because I want them to know that this is where I mean is this comfortable. All right. I haven't done a massage in so long, y'all. COVID is a mess. All right, so how do we open up the massage? How we open it? Just tell me.
Can you take two breaths with me, please?
That is so. Now that's on Mariah.
Oh, because you left. It's all right. Talk.
Yeah, sorry.
Can you take a couple of deep breaths?
All right, and then now as she takes her deep breaths, we're gonna place our hands on her, right?
Yes.
Cool, wonderful. All right, go ahead and take a couple of deep breaths. And remember, while they're breathing, you should be breathing with them. And also applying a little bit of pressure with your breathing. Come on, why y'all ain't talking? Out of order.
If it's the on Mariah, tell her to move over here by you. Yeah, I told you it's weird. Yeah, come over here.
Now it's being a hater, and now it's gonna follow Mariah, and then it's on Daisy. That is crazy.
It's around. I'll use the video she can.
I know, but
Yeah, you gotta stand in it for a couple seconds and it'll pick you up. Stand in, let it pick you up.
me, please, me, not them, me.
Yeah, okay.
This needs like a remote or something.
It's all right. It's fine. That's why I said I wanted to see what it's doing. It's really don't.
All right, well, you can hear me. All right. And if you would like, you can start with full body compressions. Pressure okay?
Mm-hmm.
And during these full body compressions, what are we checking for? What's the point of the compression?
Feel where we're trying to work.
Yeah, feel where you feel tightness there, right? All of this is tight.
Mm-hmm.
Mm-hmm. And you see how I'm just not doing one compression and then moving on. Like I want this to really feel like a hug. What time is it?
139.
And I'm gonna go right to the top of the hip. Right where I feel the bone. That's where I want to be. Please don't start in the middle of the hip. It's so incomplete. Pressure still good. Why do I check in with pressure?
To make sure. To see how much pressure is going
Can you hold it off on me?
Had a 3-hour day time.
Like I want her to be so excited for this massage after I finish with these compressions that she's like, oh yes. But then with that also, the massage has to be great, right? You can't just give a good hug, right? We can't do that. The massage has to be awesome. Remember to compress the feet too, both sides, top and the bottom. And we're always using the correct body mechanics. Now I know that this may take some time. Like, you know, this is a long process, this compression, but it feels good. And I told you I've had clients just ask for compression sessions.
Really?
Yeah, they just want me to compress them.
For how long?
The whole session, the whole 60 minutes.
Wow.
Yeah.
So you just spent 15
I
minutes.
didn't do it, but I asked for it. Because I was younger then, I was like, that's dumb. What?
Yeah, I don't know.
But now, I would do it.
You just open up each area and compress it.
Can't you just do like a 30-minute session though?
No.
Like shorten it?
No. You know how long I could actually sit here
Oh,
and like
oh,
compress
okay.
her muscles?
You
Like
do
if
like
I
that.
sat here for long enough and just let her fascia, like when I showed y'all how to move stuff out of the area, if I just sat here and just let her fascia do the work and be patient, and this takes patience to just sit like this on both parts. Like something still would happen under my hand.
Would it really address like all of the deep problems? as well?
Yeah, because I'm working through the tissues. I'm still peeling the onions. It's just slower. Also, compress, I can use my forearm. And this helps to cover a greater area. How's the pressure? And then as I sit here, maybe I feel the tissues relief, I can go in a little deeper. But I want to make sure that I feel that relief first before I just go all in. Start with the hand here. Both sides. Feel all the stuff she got going on over here. So now, her whole body is tight. I'm not gonna be able to get through everything in one session.
Yeah.
Not at all. But I'm still remembering all of this for my soap notes. So when I do my soap notes, I'm writing down all of this stuff so that I have an idea of what needs to be worked later on. And then I can give her a treatment plan for later on. This has been recorded. See, they just don't want you to move. And look, and I say that this wasn't 30 minutes, but we'll see. We'll see what happens. In school or something today. No.
Oh, yeah.
The tiptoe over there, like big head, nobody can see you. Yeah, it is. It's on the down. So now I start with, let's say cat paw or something like that. We'll see my nails go. Don't go to work like this, y'all. And when I'm here over the joint, I'm not giving a lot of pressure because it'll hurt. Because now I'm at the bone. So when I come up to the muscle, now I can start to give more pressure. And remember, we're moving our bodies. Why? Because it's a dance, not a stance. And then I start just warming her up so that her neck knows that she's about to receive work. And again, I'm still palpating to see if one side is tighter than the other. So for her, I feel like the left might be just a little bit more stiff than the right, just a little. So now I'm just gonna turn her head. And I'm not gonna start out with lotion yet. It's still palpated. Pressure okay? And I still like to ask about the pressure, because it's a new area. Up to the occipitals. Oh, okay. I thought this was lotion. It's stopping.
Yeah, they stopped me from recording the same story.
Oh, okay, that's fine.
That was a good open.
It's a good, yeah. Thank you for opening.
Okay, more my fingers for like a couple seconds because I didn't see where the camera
That's
was.
fine.
But yeah.
So when y'all work the neck, I noticed that y'all only like to work the back of the neck. Even like this, you got the client head turned like this, and you still work the back. I don't know why y'all turn my head and just work the back of the neck. I just don't. You gotta work the whole thing. So now I'm on the back, but now I'm coming to the lateral side to get scaling. This is where the money is. Scaling. Of course, don't forget the back of the neck. Because if you're gonna do all this work to the scaling, you have to still get the back of the neck. So you can't work one without the other. You have to work them both. Here I could come home. Let me use my school to my advantage. Pressure okay? And don't forget here, you have to go down in this little dip. You have to, you can't ignore that and just go like that because the stroke is not complete, right? And remember that scalenes, even though I'm going here, my pressure is still focused here, right to the clavicle. That's where you should be focusing at if you're working scaling. So. See, I'm working some stuff out. You ever heard that one? Now, knuckles. And with your knuckles, you want to watch your pressure because it's a sharp tool. Everything's so tight here, so you really can't see our clavicle, but they're right here. Now, I can get on both sides of them, so inferior to, superior to. And just going with my fingers. How's that pressure? Now, some people, you can get under the clavicle on both sides. So maybe Deja, because she don't have no tension in her body. No, it's so annoying that she has none, but it'll come with time. She's gonna get some tension, but still try to keep it at a minimum. But you could probably get under both sides of hers and work the scalings like that. And of course, all the other muscles that are there. So I like when I can get under people's scalings. It's more room to play. And then it just keeps me from not being bored, So it's about me too, not just them. And I'm not gonna work this side like I work the other one, but I still need to do something because I don't want her to be uneven and stuff. So same. Maybe I'm doing this different on this side. I'm probably doing it different. Does it feel different? No? Same? Okay. So when I'm doing a massage, I don't really remember what I do on both sides because for me it's like artwork, like I told you yesterday. Just throwing paint on the canvas, like it's abstract. So I try to remember in case they like something that I did on that side, but if they say that they like something, I'm gonna ask them what it was. Cause, yeah.
It's kind of boring to do the same thing on both sides.
It is.
I'd say even as a client.
Yeah, I just can't remember, so.
I don't know what I do.
Cause I just have so much stuff in the tool belt, you know, once you do that, once you have so much stuff, it's like, you wanna try new stuff, you know, or different stuff to see what works and what doesn't work. And like I tell you, some stuff might work for one client, but it might not work for the next. So right here, I'm just using both of my hands at the top of her clavicle. This is the work that I need right now.
Oh, what's that called?
Or anything.
So what is it called?
You said that's what you need work right now.
Yeah.
Trying to transfer. Therapist is feeling
Oh.
pain in a certain area. They may
Oh,
pain.
okay. I was just asking what
Time
moves
to
I was
transfer.
doing. All right, cool. I got you. And then you were speaking low, you got the dance going, I don't know. All against you at that point. All right, so now I am going to do some stretches. Because some people had some stretches yesterday. So let's work at what we're gonna do, all right? So I just turn her head back, now go under where the occipital is. And then just take a deep breath. Oh no, stop, go ahead, take a deep breath. Before I start, I'm gonna let my client know. I'm about to do some stretches with your neck, okay? All right, just so they know what to expect, you know? We have to communicate. Now take a deep breath. On the exhale, do the stretch. So what bones am I touching right now? What bones on her head am I touching?
That's like the temple.
Temporal, parietal, occipital. So y'all remember, look at that. And it is good to pay attention to their breathing when you do the stretching. Take it back. Exhale, take over. And like I told y'all before, I like to do range of motion testing in the beginning, especially if she was to say that her neck was her problem area. I would have done range of motion testing in the beginning to see the progress. I want to see the work that I did. It's for me, it's not for her. I mean, it is for her, but mainly it's for me to see if I actually helped relieve some of the muscle tension.
So the range of motion test is similar to the stretch.
Yes, yeah, I'm just not doing the stretch. So range of motion would have been just going here.
Oh, okay, just to see where she goes.
Yeah.
Definitely agrees. You didn't check it, but
I could also have done taking her head this way. So whatever stretch I'm gonna do, that's the range of motion I'm gonna do. So now if I wanted to do a stretch like this, I could have. I could do, so this is a stretch that I could do here. This one's for skate. You feel it?
Is a good one for SCM just the side to side?
You said what?
Is a good stretch for SCM just the side to side?
Mhm. Now what if she don't feel the stretch? Then what could I do?
Compression.
Okay, what you mean compression?
Like press down on it a little bit.
Okay,
She doesn't
yeah.
feel the stretch.
Yep. So I could pin the muscle.
Yeah.
So I could have come, if she didn't feel it, like our special friend over here, flexible Deja, I could have pinned under the clavicle. And already that is a deeper stretch. I feel it. You feel the difference? I feel the resistance here. So whenever someone can't feel like that day we was doing the stretches with Deja and she was always to the floor with her neck. You could pin, but again, if it's someone like her that is super flexible for no reason, then like they might have to figure out the stretches for themselves. Like I don't know. Someone else probably has the answer to it, but when you've done all you can and you can't do any more, give it to God. I don't know.
So you just stand.
Yeah, you know, just saying.
I was about to say the song for you.
But really, if they know how to stretch themselves, right? If you had to stretch your neck, you know how to stretch your neck? No?
I don't know.
So when you do stretch, do you feel the resistance? Give yourself a stretch now. Do it. See? She gotta do so. Oh no! All right, nope, no more, no more, no. Yeah, nope. All right, we good. I can't. Nope. I just watched what's that movie called? That was a great movie, The Last Showman or something. The Greatest Showman.
Oh yeah,
I just watched it for the first time on my vacation. Oh my God.
I didn't know Hugh Jackman could sing like that. First of all.
That movie was good. All right, so you see how I just transitioned? So I got up because I was talking, distracting you. So I got up from my stool, still with my hands here, and then transition. A good transition would have been something like this, or compression, just so that they know that this is the area that's enough to be working. And I'm so sorry for her, but I'm not working for her at the moment. And I always like to start with the break-in. Because in my head, I'm still trying to create like a vacuum effect just to get toxins out of the area. So what if your client has big breasts? I'm gonna bend their elbow, and then I have more room. Of course, the breast is still gonna be probably right here, but I really don't want to be up against them. So now I just give myself more room to work. And also by doing this, I can do some pulling. How does that feel? Yeah. I could also do some opposing with tricep and bicep. Kind of awkward, but you can do it. Yeah. Now come to the forearm. And we can move the forearm, look and move, y'all. And remember to work both sides, all sides, to work lateral, medial, and posterior and inferior. Now this is how I would work the arm if I was not focusing on the arm. If I was focusing, I would sit down. Because then I could do other stuff with my elbows and, you know, have some with her fingers, moving them around. Come to the hands. Always work the hands. They complain if you don't work the hands. Fingers. Get the fingers in there too. Just make sure your client washes their hands before. Who remembers how to ask them to wash their hands? No, that is not what you said. You're asking. I don't want them to I don't want it to be a question. Remember? That's why I just changed it. How are we gonna get our clients to wash their hands?
We both wash our hands.
Yeah, but what are we gonna say?
I'm gonna go wash my hands. You wash your hands in the bathroom. Before we start, can you go wash your hands and I'm gonna wash my hands as well?
Yeah. So I'm gonna let you go wash your hands and I'm gonna wash my hands while you go do yours. That's it. And then they come out the bathroom with their wet hands and then we can go into the room so everybody wash their hands. And then we can be confident that I can go and work till the next thing, right? Because they're not next anymore. All right, now I'm finished. So she had her arm folded. I'm gonna put her arm. Oh, you should have seen.
No, it's not that. This is blood flow.
Oh.
You know, when my blood opens up,
All right, so
It's true.
her arm was across her chest, so I'm gonna put it back where I left it at. Right, and then now I just transition to the other side and do the same thing. Damn, beautiful. Right. Now I'm gonna transition here. I think, would it be better to work that leg or this one for y'all? This one? All right, so I'm gonna transition over here like I already worked that. Now, we know that if we're in a spot, we have to remove the blanket before we do any compression. I wish that I would have done that in that video, but whoever watches this, give them a disclaimer. So here, again, just the breathing, just to get the leg like excited for me. Draping.
What's your typing? I mean, what mouse is over in the corner? On something.
Yeah, draping. Look at that beautiful drape.
That's what I need more practice on.
And you shall receive it today. Hand never left her leg or her thigh.
You didn't ask me, but I ran into the table.
I was about to ask you.
I ran into the table 2 weeks ago in the classroom. It doesn't hurt anymore, but you might feel it.
How's the pressure?
So if a person have a bruise right there, do you avoid that area or you still working?
No, I asked her to still hold it.
So if it does bother you, then you avoid it. Okay.
Nothing. Yeah. It depends on how it looks too, right? Like if they're more fair skinned, then you can usually tell when you shouldn't work that area. Yeah. So. And some people just bruise easily. So, if that's the case and they bruise easily, I will avoid it. They tell me, no, I just bruise easily, like I'm going to avoid that area. Especially if I don't know them, if they're fine. You're not going to say that I did for protection. So protect yourself.
I just want to say though, but avoiding that area doesn't mean not working in this area.
Yeah, no, I'm just gonna
work around.
Yeah, like this.
Okay.
Yeah, but we didn't say avoid in person. We'll get that all down there.
Yeah, I'm glad that you cleared that up. So yeah, and I know how to avoid. I am to be avoided. Just not. I don't like certain stuff. So now I've already ordered my arm. Going all the way up to that top pelvis bone, whatever you want to call it. Pressure still good? Mm-hmm. From here to the side. Y'all like that? That was cool, wasn't it? I like this transition like that. They wasn't. They missed it. They missed it. Relax this wrist. And I'm also getting the top of the knee, the side of the knee. So I get it all. Laterals to side of the knee. Yup. Correct knee. Both. Create a stretch. Always go to the knee. So I'm at the top of the hip and the knee. Pressure good. And also, since I'm over here, you still need to be careful of the IT band. Because we know that can be tight on people. Depending on what they do with their runners, exercise people. After me. You see how I had to remind myself to wait? All right. You go over a spot that feels tight, go back to over. Now I don't want to work the adductors. Figure 4. So easy, right? Look at that, Sheree. Figure 4. That was beautiful. Know that this area could be really tight for some people, really sensitive.
I should be trying to get all the way up to the Titanics.
That's where I'm going. Pressure. I'm going all the way up until I can't go no more. Am I gonna work this on everyone? No. Everyone doesn't need this work. But my intake will have told me if someone needs this work. She's a dancer.
Is that like real?
Huh?
Like for real?
Yeah.
What type of dance? What type of dance?
Mainly right now, I mainly do hip hop and line dance.
For adult?
And Zumba.
Oh, Zumba.
But I've done everything. So
The runners, bike riding, horseback riding, motorcycle riding.
Shantel, question.
Yep.
MSK. How much more schooling would it take for like what to do horse massage?
You would have to go to vet.
I have to go to vet school and
I didn't know they had.
I mean, it's not for me. My friend, she's doing it. Because she's a massage therapist now, and she was telling me that she wants to do horse massage.
Yeah, she should.
I was like,
I
wow.
probably make a lot of money.
So the only other way, not around it, but is you can be a vet tech. So you can go work with the veterinarian, because you are a massage therapist, they'll train you. You know what I mean? You can do the massage, but you're not doing it as a massage therapist, you're doing it because you're a vet tech.
Got it. Oh, that's cool.
Yeah. Equine massage.
But you probably have to work for a veterinarian that serviced a lot of horses
Oh,
versus one that do like dogs and cats.
Now, I'll put you are a campus president.
oh no, it's not for me.
Oh,
I'm asking
okay.
because my
So,
friend.
but I'm telling you because we can ask him too. He is, he's a massage therapist by trade for many years, but he stopped after like 20 years working with people. I said people, and he does only animal massage. Yeah. So he actually he has a farm, and now he just works with animals. He's up in Pennsylvania, so I don't know if the legalities are different.
Right, of course.
So why the ladies he has come to the camp? You know, so get that knee on this side.
Would you recommend us working the camp if they have a lot of, like if they get a lot of tightening or tension? I mean cramps, even if they're cramping?
Yeah.
Really?
Yeah. You can just fix the cramp, take it out.
Wow.
Yeah.
Okay. I would be so scared to touch it because I know how a cramp feels. And I just want.
Yeah, but if you can get it out for them, then, cramp management.
And
So-
educate them.
I could, so if she had a cramp right now here, I could have her activate the muscle, and then I'll work with it.
So you do like plantar foot and then just work that.
Yep. So, go ahead and plan our foot.
So would you do petrissage or just
No.
compression?
But that might not work for her, right? So then I could do compressions. I could compress the muscle. So you just have to find the one that works for them. But that reciprocal innovation works the most. So that's what we just did was reciprocal innovation.
Would you recommend us doing that if we work on a pregnant person and they get a cramp?
Yeah. What do you say? No?
Yes,
You
you
say
can
that?
do that, but before you work a pregnant person's leg, you should test them anyway for, cramping, for deep vein thrombosis. And so that's one of the difficult things about working with pregnant women. You can work with pregnant women, but you want to work at a light level on their legs if they have said that they have a lot of cramping. Check for that DVT, and if they don't have that, then you can work the cramps and do it.
On a side note, if you want to be pregnant for yourself, you should take somebody's prenatal class so that you can learn.
If you want to, I will.
Yeah, you know.
I'll be there.
What else could they do at home to avoid cramps? What are they not doing? Okay,
That's all I've heard.
Epsom salt baths.
okay.
Not
Drink
enough
of water,
Not enough water.
drink more water to help with circulation. So suggest all this stuff, and then her favorite Epsom salt bath. But she loves Epsom salt bath.
Yes.
So
the first thing.
always.
That's what I do.
Always.
I do it
Epsom salt.
I do it all the time.
Epsom salt.
All the time.
So I'm transitioning to the other leg, even though I'm not gonna work it. Sorry, I'm just not. So here, oh, man.
I see the chart
Somebody else
a
can
lot.
work it. Somebody else can work your leg. You should have told me I would have started over here instead of listening to them.
That's all right.
All right, so you see how I'm transitioning? Move the sheet. And then do the same thing. I'm gonna get Sheree to work your leg. All right, I'm gonna turn you over after I set up the face wrap.
I do have a question for Mariah though.
Yes.
I mean, I know I'm not an actual client, but you know, what about my leg made you think about horse massage?
Oh!
Oh, yeah.
No. It was nothing about your leg. It was when y'all, what were y'all talking about before we started talking about horse massage? It was
Stretches and working effect. I don't know.
dancers.
Dancers.
Thank you. It was the dance. And then I started to think about how dancers and people who are athletes have like real strong muscles.
That's
Then I started
fine.
thinking
I just
about
want to make sure now.
No, it has nothing to do with
I know. That must be, she must know some stuff. Is that come? No, I'm gonna move it a little.
But I need to tell you something.
You can't breathe.
What side you work, my right? It's fine now. My right foot was right.
See, because they started talking about
You
crying.
didn't do my foot.
Oh, man, I didn't. Oh, you see that? I work her foot. Why don't you tell me?
My foot.
I don't know. I don't know.
This side, I'm gonna work her foot. I know, but I forgot. See, what happens when you get distracted in your massage, you forget. But the good thing is I'm not finished working her body. So
Cause you still get a feedback.
this is the way that I like to work the foot anyway. So when they're currently fine, I usually don't work their foot. I just don't. I like to work their foot when they're prone.
That foot was new, but it was like,
But it's a good example of feeling complete. If you don't finish the limb, foot and hand included, I tell you, it's gonna fail. Like you just did all this nice work and you're not gonna finish, so you have to finish. Alright, so I worked the leg already. Now let's get that foot real good. I sit on because I like to use my forearm and elbow and the foot. You look up the leg over. Move the bolster over just a little bit. How's the pressure? Is the camera on?
Yeah, can you put the sheet that I blanket down a little bit? But
Yeah. Just more pressure. Pressure good? Mm-hmm. Get all up in the metatarsals. This is just easier for me. I don't like to use my hands a lot, but I also want to get pressure on the foot. So this is the best thing. If I would have used my hands right now for this, I couldn't. I wouldn't be able to give her the pressure that I wanted to. Hold, move her leg. Now I can get top of the foot. Pressure still good. Hmm. And you should always be able to change up your pressure for each one. Go back. And again, someone has longer hair, get a towel and put the hair, the towels on their head. Pressure good here. Also, make sure you go into the dip of that bag. I got a massage once and they kept avoiding that. I'm just like, what
that's
are we
the main
doing?
part of the bag.
What are we doing? And I could barely get off the table. After she got finished work, I could barely move. Because she had irritated it so much but didn't work it. I was mad. I seem to always get those people. Everything else was good. All of this was good. It's like someone told her this was an endangerment site and she just went with it. Like, man, my kidney's not even all the way down here. They up here. Come on. Look a mess. Still haven't found my perfect massage therapist. I'm about to have to go to Arlington.
You might have to go to another state.
No, I think that she has to find a person for different parts of the body.
Yeah, but that's money.
It is, but
Some people do.
I have multiple jobs. I can't
Wow.
just do one.
That's so much money. I thought that is like, oh.
It's expensive.
Maybe after I get a mortgage and don't have to pay the expensive rent, and maybe I can afford to get massages every month. You have to have me a massage coffee pot.
Yeah, somebody who's been teaching, how long you been teaching?
I mean, that's
Students like these people over here,
yeah.
yeah, they love to work on their homework.
I think I might go to Laura because oh my goodness, when she worked my leg,
I told you, Linda,
I know, but that's the problem. The good ones are always so expensive because they know their worth. Darn it. How's the pressure? Hmm. Yeah, okay. So, you see that transition? Like, I can't talk through it. I can't tell you when I'm about to do it. It just happens. So you gotta pay attention. You know, just, you know. I know this is boring, but y'all asked for it, so. Pressure good right here. And see, no one ever does this. You said you might be lying. Always 2 hands on the body. I could be doing something down here. I like to do this, work in 2 different spots if the first spot is like really tight and I need to like dig in. Because I feel like it distracts them a little. Yeah. You know, the mind tricks that I like to play on clients. So now their body doesn't know what to pay attention to. And then I like to go to the sides, get those ITG muscles. What's the ITG muscle?
You said ITG?
Uh-huh. You don't remember, you worked them on.
And test the
They don't start with ITG.
oh.
Name for their sensation.
Well, I know the pectoralis is on the other side.
Yes, good.
So that's the major
major.
or minor. This would be major, then that should be minor, right?
2 majors and a lady.
Oh, it's 2 majors and a lady? Is that the
So
same?
major? Yeah.
I never knew that.
Yes, you did. You wrote it down.
I
You probably wrote it down like
probably-
3 times because every time I said it, you said, I never did
No,
that.
you know what it is? It probably didn't make sense
Yes,
now.
it
I mean,
did.
a lot of stuff make more sense now because you've been hearing it for a while.
Mhm.
But what are the 2 minors and a
There's
lady? I
major.
know that.
Teres major, pec major, latissimus dorsi.
Okay,
Those are ITG muscles.
okay.
The lats. Now go to your technique notes. And it's written down in there 5 times. On 5 different sheets of paper.
2 majors and a lady.
Yeah.
2. So pectoralis major, minor.
No. She major, pec major, and teres major.
Paris major. Okay, and then
Latissimus dorsi. That's why you have to keep studying it. Because you should know the muscles that you're working. If you know the muscles that you're working, I go over there to y'all. It's a trader, man. You done followed me this whole time, and now you're gonna trade on me like that.
That's what they never stop seeing it. People in the field.
You felt that weight energy. So, latissimus. This is where I will work the back of the neck. Of course, I start while they're supine, but you still have to work it from this way. Now, if someone's neck was shorter, like mine, I've been told my neck is short. I don't know neck, it's a shame. I could have her sit up and then I would lower the paper. I'm not doing it, but I would do that if I needed to open up this area more. It's kind of like you're a bear, you're grabbing your junk right here, you yank it somewhere else. And then with my thumb, even though I don't like using my thumbs on the side, knuckles, until latissimus. Did I say latissimus? Levator scapula.
I was like, wait a minute, you just said that was a side muscle. Okay, so maybe stretch from the side to the back.
Corrected. Yes. Levator scapula here. Supraspinatus, right there.
And that's a rotator cuff.
Mm-hmm. What's the other rotator cuff? Give me one more.
Infra. The name.
Mm-hmm. And a minor. Mm-hmm. And then how am I going to close out this session? Where did I skip? Brianna's favorite scratching that word.
Oh, yeah.
You can't leave and not work with glutes.
Do you always have to work this glute tendon sheet?
No, but she has on undergarments, so if she had them off, then it would be exposed. I could have exposed it with the back, or I could have exposed it with the leg.
Okay.
And Brianna's gonna come over here when I'm done and work for other glutes.
I don't think Brianna have a problem with women, it's men.
I don't care. I don't care. You got a problem with glutes. What other glutes they are?
Yeah, it's all right.
I think I had I ain't want to say it out loud. What is it called? A counter transference moment with that guy.
Mm.
He reminded me of somebody. So that's how I was just so.
That's a good
Okay. All right. Well, what you gonna do about that if that happens again? Because you have to fix that. Because it's not that person. So what are you gonna do to prepare your brain in case that happens again?
Girl, they just rub their booty.
You gotta massage the glute.
Massage the glute.
There you go. So much more protection.
Yeah.
What you gonna do?
It's maximized.
You gonna choke up?
No.
All right, you gotta massage them, right? And say, you know, this is not that person. Because if it was, I would punch him. But it's not that person, so I can't punch him. So I just have to massage him with love, right?
You could put on some music, just zone out. Yeah, just put it around, going on another.
Bam! That is my massage, you guys. So now, ending it. Take a deep breath.
I want to get one of them things. What is following you? That camera.
Yeah, if you're the only one in the room.
I like that. It's expensive.
I don't think they're that expensive. I really don't. You could probably go on YouTube and find an ad from someone's video and use their phone. All right, I'm done. Thank you for letting me work on you today. And I'm gonna step out while you get dressed, okay? And that's it. That's our time. Oh, yeah, I forgot.
You know what's
Brianna.
She said her name is
Brianna. So, you say that Brianna gonna work at Lee, and then Sheree gonna work the,
Brianna, come, I can make it so she can work with Luke.
How we turn this off?
Go, hit the button.
Oh, hit the button.
I mean, hit that screen, I'm sorry. Hit the screen. Yeah, and it's just like, it's on my Zoom, so you should be able to push,
In meeting.
yeah.